Okay, I see the numbers have slowed down as people have started to join, and I'm sure we'll have others join us as we move forward. But for the sake of time, I think we can go ahead and get started. Welcome. Thank you for joining us on this Wednesday morning or afternoon, depending on where you're calling from. My name is Carrington Lott. I'm the Deputy Director at Systems for Action. And if you're not familiar with Systems for Action, we're a national research program office funded by the Robert Wood Johnson Foundation. We're housed in the Colorado School of Public Health at the in the Health Systems Management and Policy Department at the Colorado School of Public Health. So one of the main activities that we do as a National Research Program Office is release annual funding opportunities, and research teams can apply for research funding, and all of our funding opportunities that we release have this one thing in common, that we're trying to align systems. And when we say systems, we're referring specifically to the public health, medical, and social service systems. So research teams can give us their innovative ideas of how they might want to align across these sectors. And so we host these. Hold on just a minute. I hear some feedback. Sarah, I don't know if it's your phone or not. I'm going to mute you real fast, and when it's time for you to chat, I'll unmute you. Okay, great. So then we also host these bi-weekly research and progress webinars where we invite the grantees who received research fundings that applied to our funding opportunities to come and provide some rapid, sort of real-time updates on their research projects. So today you are joining to hear from a team at the University of Washington on their project titled Achieving Reach in Youth Behavioral Health and Wellness Through Catchment-Area Community Governance. And this team applied for a 12-month developmental pilot award, and they will be wrapping up their study in the next couple of months. So I think they're going to have some exciting things to share with you, as this is their second time presenting here in our Research and Progress webinar series. Maggie, can I get you to go to the next slide, please? Just a couple of housekeeping items to cover before I hand it over to Dr. Walker and the team. We're here in our welcome. I'll be finished in just a quick minute, and then you'll be hearing from the research team. Dr. Walker and Alya Azman are going to be sharing about their research project. And then after that, we will hear briefly from Drew Hill and Anna Tresidder, some commentary, and they're going to speak to the importance and the relevance of this research project. And then we'll reserve time at the end for some Q&A. So we typically have about 10 or 15 minutes for Q&A. So if any questions come up at any point during today's webinar, go ahead and locate your Q&A box at the bottom of the Zoom screen, put your question in, and we will do our best to get to all of the questions that come in. If we don't get to all of them, we will give the unanswered questions to the research team so that they can address them at a later time. And then lastly, today's webinar will be recorded, and we will email out the recording as well as the slides that the research team is going to share today. I think next slide is going to kick us off with Dr. Walker presenting. Okay, Sarah, I think you're still muted. Let me unmute you. There we go.
All right, can you hear me?
Yes. Oh, we lost you again.
Okay, can you hear me without an echo?
There we go.
Okay. I was just explaining that I have bad bandwidth today, so you may see me freeze, but I've got audio backup, so I will continue to talk, and I'm hoping to just not get actually kicked off, which I just did. So we'll hope for the best as I'm talking. But we're really excited to be coming back to this group and talking about the progress that our research team made and our implementation team made with the support of the Systems for Action Award. Briefly, my name is Sarah Walker. I'm an associate professor in the Department of Psychiatry at the University of Washington School of Medicine. I direct the CoLab for Community and Behavioral Health Policy. We're essentially a youth wellness policy think tank. So we have sort of a combined portfolio of competitive research projects, but also really active collaborations with different levels of local government, mostly in Washington State. And I'm going to be joined today by Alya Azman, who's a research analyst in CoLab and took took a lead role in some of our data collection and triangulation activities that we're going to be presenting today. And then I will introduce our commentators a little bit later in the session, and we're really excited to have them join. Next slide. Maggie, I think you're doing slides. Next slide. Thank you. Thank you. With this project, we were aiming to understand the process of standing up a youth wellness hub or a youth wellness zone. So this is in the tradition of place-based efforts to support ecological approaches to health. So in contrast to working primarily out of a single system like healthcare or primary care, specialty care, or public health, or another health system, we were looking at the kind of a neighborhood, multi-neighborhood level of governance and coordination as a way to try to line up all of the different contributors to youth wellness, and with a focus on youth mental health and substance misuse prevention in particular. This is a little bit of old wine in new bottles. So there was a big push for neighborhood-based, place-based approaches for particularly violence prevention, youth violence prevention back in the 90s. The White House had an initiative, Promise Neighborhoods. Annie Kesey supported a lot of work in this area. Robert Wood Johnson was involved in this work back in the day. And there was the literature that came out of that was a little mixed. And I think it's sort of because of the complexity of trying to do this work from kind of the neighborhood up, sort of languished a little bit, and there wasn't a lot of active research, but definitely a lot of initiatives that continued to operate in this way. In Washington State, actually, we had an entire sort of state RCW with a ton of regulations and funding lines, and around something called community, I want to say prevention and safety networks. And then in the recession, it all went away. It just like disappeared. So one of our interests was, what does it look like to try to stand these up again, kind of from ground zero? And along the way, we were able to connect with existing place-based efforts focused particularly on youth and child educational outcomes in Washington State. And we were able to sort of join that network, and together we were able to secure another year of operating funds for these place-based efforts in Washington State to focus specifically on youth mental health and wellness. So we're really excited about that. So, right off the bat, I want to thank Robert Wood Johnson Foundation for giving us some, a platform to start talking about this, join with other partners, and secure some legislative wins in Washington State. From the research perspective, as Carrington alluded to, we're still in our final data gathering phase, so we actually don't have like really clear outcomes yet on some of our aims, but I could definitely talk through the process of doing this over the last year, really over the last couple of years, because we were already engaged in partnership in this area for a while before we got the funding. And then anecdotally, sort of what we saw evolve around those research aims with collaboration and synergy and financing, and where we're heading next, and trying to support this kind of approach to youth mental health and wellness. Next slide. So basically, these are sort of the core features of doing place-based work. They involve heavy community governance. So, and there's a distinction to be made between collective impact, which could also happen over like at a county level or a really like wide geographic region, and these and these real localized, place-based, kind of neighborhood-based approaches, where you're really looking at something that's more like a high school catchment area. And the idea of a community board with making decisions about the allocation of funds or priorities is that folks are making decisions about the services that they are directly using. And that is one of the benefits of having these place-based approaches, is the level of community mobilization and civic engagement around services that will directly benefit them. And then having a strategic framework for planning, having a broad communications plan to try to engage as many people as possible from that community, as well as feedback and information. And then implementation strategies. So what do you prioritize? How do you carry those things out? How do you bring all of the sectors together? And that's where collective impact models are super helpful and relevant here. And there's a lot of initiatives out there that are engaged in this work in really successful ways. Next slide. One of our kind of core analytic strategies when we get our time to data will be social network analysis. So because these efforts, we expect to see health outcomes, we won't see health outcomes for years, probably from these. We're not looking to measure like public health data points in a year, but we are looking to see whether the activities are creating stronger connections among relevant decision makers, sector partners, and community members in the interim. And we're also very interested in seeing whether the process of engaging in this kind of community governance activity and this collaborative activity is helping to create shared meaning and shared motivation among these different partners. And we're doing that by identifying kind of folks' core ideas or beliefs about what will help to improve youth mental health and wellness for their community or for the relevant community, and looking to see whether over time we start to see more alignment in what folks would prioritize or they think is going to be the best strategy. Next slide. I just explained this, so next slide. All right, so I'm going to turn it over to my colleague, and Alya is going to talk a little bit about some of the data gathering methods we use to try to triangulate data from multiple sources. Go ahead, Alya.
Thanks, Sarah. Hi all, I'm Alya, research analyst from CoLab, and I'll be speaking on community assessment methods that we use as part of this project. So one of the main goals of this project is to identify the mental health priorities of youth in the Parkland area in Washington state. And to do so, our team used various synthesis methods to triangulate data across 3 different community outreach methods. And the first one is community survey mailings. So we distributed the Greater Parkland Youth Wellness Survey to Parkland residents and asked respondents to rank the most significant goals and challenges confronting the youth in Greater Parkland. And we conducted the survey over 3 phases spanning 4 months, and in total we collected 28 survey responses. During the first phase, our partner organization, Safe Streets, conducted an in-person outreach by distributing flyers to residents and businesses in the Parkland area, encouraging the community members to complete the survey. And 11 survey responses were collected. And for the second phase, we utilized the Every Door direct mail service provided by the USPS, and we sent out postcards to 5,000 addresses across multiple neighborhoods in Parkland that were selected based on high residential density, as well as a significant population of individuals under 18. And the postcards include a brief description of the project, and along with a QR code and a short link directing recipients to complete the survey online. And this phase resulted in 13 responses. And for the third and final phase, we sent out mailers to 100 addresses in priority areas, and each mailer included a $5 gift card, a printed survey, and a return envelope, and also instructions for participants to complete the survey online if they choose to do so by scanning a QR code. And this phase, we were able to collect 4 survey responses. Next slide, please. And here are the findings for the Greater Parkland Youth Wellness Survey. So for the first question, what is the most important goal for middle and high school youth in the Greater Parkland area? The respondents rank being happy and self-confident first, and having positive goals for the future second. And for the question, what is the biggest issue facing youth? Violence is ranked first, and lack of motivation is ranked second. And for the third question, what is the biggest mental health need for youth in the Parkland area? Anxiety is ranked first, and depression is ranked second. And the survey also included an open-ended question inviting respondents to elaborate more on their perspectives. And the most common theme we found was safe and positive activities with caring adults. Next slide, please. And the second method as part of our community assessment is the town hall. Safe Streets conducted the Parkland Community Engagement Summit on February 3rd, 2024, and it was attended by around 25 Parkland residents. And during the town hall, they discussed the biggest issues that are currently facing youth, families, and residents in the area. And here are the priorities and issues identified. And the first priority was accessibility and awareness. Residents reported that there is a lack of accessible programs. They also reported there's a lack of connectivity and communication between neighborhoods and organizations. There's also the lack of awareness of opportunities among youth. And the second priority is social and emotional wellness and health. Residents reported that there's bullying, anxiety, and harassment faced among youth. And they also reported that school counselors in the area are overworked. And youth also have low self-esteem as one of the main issues. And the third is public safety issues. Residents reported vandalism, car theft, street racing, youth vaping, and also substance use. And the fourth priority is foundational needs. Residents emphasize prioritizing housing, nutrition, and finances, and also express that there is a lack of financial opportunities, and there's also problem with homelessness among youth as well. Next slide, please. And we then cross-reference our findings from the Wellness Survey and Town Hall with data from the Healthy Youth Survey. The Healthy Youth Survey is a statewide assessment of youth behavior in Washington State, and we specifically looked at the health behaviors of 8th graders in the Franklin Pierce School District. And the surveys and the Town Hall reveals an overlap in findings where the highly ranked priorities correspond to the highly ranked behaviors. And as you can see in the graph here, the overlapping results are represented in the green bars. For example, we can see that 64% of 8th graders reported feeling nervous and anxious, and this parallels with the findings from the Wellness Survey and the Town Hall, which identify anxiety as a big mental health priority to be addressed. And the same goes for youth not having after-school activities, and youth feeling sad or hopeless every day, as well as youth feeling low or only slightly hopeful. On the other hand, we did see that in the Wellness Survey and the Town Hall, violence, public safety, substance use are ranked as top issues, but this contrasted with the Healthy Youth Survey, where physical fights, vaping, and marijuana use has low reports. And this can probably be addressed to youth underreporting their health behaviors. And I will pass it back to Sarah to discuss the next steps and observations. Thank you.
Oh, we can't hear you, Sarah.
Sorry, thank you. Thanks. That was wonderful, Alya. Thank you. So what we were really focused on in contributing to in Greater Parkland, what we felt like CoLab could sort of uniquely be helpful around these community initiatives and infrastructure building around place-based efforts require a lot of different capacities. You need to have a really strong convener that is credible with multiple sectors. The community needs to have the capacity to sort of absorb information and utilize it strategically. There needs to be sufficient pooled funds to make direct decisions about funding. What we were able to do uniquely was try to help manage information complexity. So as Alya just referenced, we used multiple methods of information gathering, and then we used the strategy to triangulate and connect that back to local resources. You can go to the next slide, Maggie. This is a little tough to see because we're trying to get everything onto one page. But once we identified the common priority areas, the common needs across multiple data sources, what really emerged from the data was the need to focus on adolescent depression in particular. And we used a health prevention framework to think about how that would manifest across like a whole ecological system of health. So you could see in this resources list, we were eager to think about universal prevention strategies, primary, secondary, tertiary, and then quaternary prevention. And at the very base level in the area, we saw these needs emerging around economic stability. The region that we were working in, Greater Parkland area, is unincorporated. There's no city infrastructure, so it really suffers from not having like dedicated civic sustained infrastructure to focus on these needs. So the residents of the area are very resilient and very resourceful. But even so, the area has had historically has struggled with maintaining strong economic, stability and growth, housing. So it's identified as a community of opportunity by the local health department because of lower expected, life expectancy, higher rates of mental health need, etc. So at the very basic level, we make recommendations around building economic capacity and tie it directly to initiatives that the community was aware of that were already happening in the region, to make that not just a general recommendation, but a really specific recommendation about existing initiatives that this area could be tapping into. So for example, the city of Tacoma, it has a universal basic income pilot running. So we're recommending that they connect with that pilot to bring some of those pilot funds and some of that approach around economic stability into the region. Similarly, the county has an initiative around community land trusts as a way to build economic stability as well as increase affordable housing. So connecting that community to that other county initiative as a way to bring resources into the area rather than maybe totally starting from scratch on some of those more social determinants of health needs. Similarly, with community engagement, there was a lot of feedback, as Alya, showed us, that the community has, a few folks that are really mobilized and active in trying to improve the conditions of the area, but there's a fair amount of disengagement, a sense of hopelessness among a lot of the residents of the area because of some of the persistent challenges that plague the area. And so making specific recommendations around community engagement and community mobilization with existing organizations already working in the area, doing that work. So recommending more support and funding to those organizations to help get people engaged in some of these neighborhood mobilization and community engagement strategies. Our top recommendation for the region was a vast expansion of participation in youth after-school activities. There was only one formal organization that was offering any after-school activities in the entire region. It was a sports program and it's great, but obviously has limited capacity to serve everybody and serve youth who have different needs than sports. So because youth adolescent depression was kind of came up so high as a need for the region, and we saw kind of correlational or concurrent reports of like high screen time, higher than the state average in obesity, lack of engagement in these activities. The frontline treatment for adolescent depression is something called behavioral activation. And it's really about going out and doing more things. That's the thing that'll help most with adolescent depression, at least at the sort of mild to moderate levels. So there's multiple benefits for the region to really focus specifically on that area, both directly for mental health as well as youth development overall. So making some really, again, specific recommendations for the region around their partnership with existing organizations focused on that, like Schools Out Washington is a state nonprofit specifically focused on coming into areas and building more capacity for youth after school and positive development activities. And then moving up the kind of treatment continuum, looking at the providers that are serving the area. It is a bit of a service desert as far as mental health. So really thinking about integrated strategies, school-based strategies, as well as having good primary prevention of adolescent mental health happening in faith-based institutions, the community centers, the schools, and partnering with providers that are already doing that kind of work. And then ensuring that those that are treating the moderate to higher level needs are fully aware of the resources available to them to deliver, particularly treatments for anxiety and depression at the kind of the highest quality level, making some recommendations about resources that they could look out for that. And so on. And quaternary prevention is a newer kind of level in this sort of prevention continuum, which is really, really important because it speaks to not over-serving, particularly not over-serving youth in constricted contexts. So making sure that youth who are experiencing a lot of mental health crisis or coming into contact with the justice system, that there, as much as possible, that region is using their in-home services to work with the families around youth needs and trying to avoid out-of-home placement, except as absolutely necessary. So this just gives you an idea of how we try to help manage some of the information complexity using a prevention framework and also using all of the information and data collected from the community. And then at this point, the community has this report, and the state proviso that I talked about at the beginning of the session will help support, give the region kind of a funding boost so that they can identify an organization to hold this piece and build, hopefully, sustainable infrastructure for standing up the place-based zone over time. And right now it's looking likely that will be a healthcare organization that's already been doing a lot of community mobilizing work in the region. And that would be wonderful if if that goes forward. So I think this is the last slide that I'm speaking to. So I will go ahead and hand it over to Anna and Drew just to do quick introductions. Dr. Tresidder is a public health researcher with tons of experience in healthcare systems improvement, behavioral health organizations. She's currently directing operations and research at Excelsior Wellness, which is a really impressive and exciting healthcare organization in Spokane, Washington. And Drew is the CEO for Excelsior Wellness and really a leader statewide for Washington State around innovative, holistic, and integrated solutions for mental and behavioral health. So I'm thrilled to hand it off to Anna and Drew to provide a commentary on this project and talk about place-based efforts overall. Anna.
Actually, we're going to start with Drew, and I'll come in for the wrap-up. All right, thank you so much, Sarah, for the introduction. And I'm very excited today to share more about why some of this research is so important. The opportunity that we have in each neighborhood is to create not just a hub for youth wellness, but for wellness for all residents across the lifespan. So when we think about a project for a neighborhood that's going to create a hub to provide access for various services across every level of care and every stage of life. So if you would just imagine with me for a moment, imagining a neighborhood where an elder who needs varying levels of care doesn't have to leave their neighborhood. In fact, the hub has opportunities to provide care at every level of need and at every life stage so that we can prioritize the opportunity for those elders to experience generativity, to give back and to mentor. One of the most important things that I think we've heard today about the experience of people in the neighborhood is that we need activities and we need them every day, and we need them with positivity, and we need them with caring adults. Imagine with me too a neighborhood where a youth in that neighborhood has caregiver loss. Imagine a hub's ability to prevent that youth from entering a system which will immediately displace its belonging in that neighborhood. An opportunity for a hub to provide access to single family housing that's there only for the purpose of caring for those families who have stepped up to say, we will do the piece to keep this child in the neighborhood. And imagine a neighborhood where young adults have access to transitional housing within a neighborhood so they can build skills, receive mentoring, and practice independent community-based living. It's that kind of vision that I think really stirs up the importance of this type of research so that we can better understand how to create neighborhoods that are full of the services we need to promote our health and wellness. They're accessible and relevant to the local population. So as we've been working at Excelsior Wellness for decades, we've learned a lot from the people that we serve, and we've engaged our community in a lot of discussion about what are the things that they need. And that helped us develop a few guiding principles about our current project in Northwest Spokane, where we have been given an opportunity to build something like this with our 3 surrounding neighborhoods. Those guiding principles that we are leaning with is that we want the neighborhood to reflect the identity and the history. We want it to be culturally responsive to the people of that area. We want it to promote health and resilience, and we want to foster social connectivity and inclusion. And so one of the ways that we can go about this is by leveraging what we know about health and wellness. And we've used the 8 dimensions of wellness to help us guide our thinking and our discussion about what needs to be available within these hubs. And so quickly through those 8 dimensions of wellness, we're going to just capture the essence of each piece. So emotional, managing stress and adapting to change. Physical, emphasizing nutrition, exercise, and disease prevention. Occupational, finding personal satisfaction in our job and career. Social, building strong social connections and relationships. Spiritual, searching for purpose and meaning. Intellectual, engaging in thought-provoking mental activities. Environmental, promoting eco-friendly practices, sustainability, and harnessing the therapeutic effects of nature. And financial, managing those financial resources effectively for security. And this is all about how we're promoting a balanced and healthy lifestyle. In order to do this, there are challenges, and we have to focus on our observations and our opportunities. And so in terms of challenges, I think complexities is the important place to start. There's a lot of stakeholders. There's a lot of different sectors, and there's a lot of different interests. And so when you try to sort of bring all of these different social health and human services together and create accessibility for them in one space and have them reflect the identity and cultural needs of the neighborhood, you really have to bring a lot of stakeholders together. In order to secure funding, you're going to have to walk through really complex discussions about how we're leveraging the resources, the institutions, and the people to make sure that the funding is secured. And again, all of this while addressing community-specific needs. So what we've learned throughout the process is that we have to really focus on adaptive planning. We have to be flexible and we have to be nimble. We have to continue to listen and continually learn from the unique experiences and needs of the community members. And each neighborhood is changing as we go. We also need to emphasize sharing what we've learned. There's a lot of information institutionally over decades of serving youth and families and elder caregivers that we need to continue to educate the community about what we're seeing and what we're observing. And then lastly, I'm going to share a bit about the opportunity. If we have a place where we have a holistic set of services and we're able to enhance the well-being of every resident, how are we going to make that accessible? We have to put them in places that are walkable. We have to create access for everyone. We have to emphasize this convenient access. We also need to ensure that support services include health and wellness programming, peer support, community health workers, and other essential resources. We need to be able to position those within these key spaces. And then the funding, for it to be sustainable, we have to think about the behaviors of the people in the neighborhood. People purchase the things they want to need, and people pay for housing and other resources that they need to be well. So our model here in Spokane is to leverage those two things to create this space where we have a hub of social health and human services. We have a village center that has every level of care, including single-family homes for fostering children, transitional housing for elders and young adults, assisted living, memory care, adjacent to skilled care and end-of-life care. All of that centered around the social connections, the social activities, the playgrounds, and all of the things that keep that community together. Well, in order to keep sustainability in terms of the finances, we're going to anchor those things with housing, and we're going to anchor that with a walking district for shopping. Local businesses providing residents with easy access to the shops, the essential services, the cafes, right outside their doorstep. It's going to promote a social hub for neighbors to connect and enjoy those amenities. And so if we can think about how we build these neighborhoods and we put them around these hubs, this research around the Youth Wellness Hub can help us connect neighborhoods to one another to build learning improvement communities across each neighborhood. So I'm very happy I got to share that with you today. And I'm going to pass it to Dr. Tresidder to share more about what we're doing.
Thanks, Drew. Now, from the really big vision, and I'm going to drill us down just a little bit to our most recent project that was really informed by what we were able to observe that was going on with the Parkland process and working closely with Sarah and her team and the folks with Safe Streets and being able to take a lot of what we are observing and learning and bring some of those lessons back. For those of you who don't know, the project Sarah just discussed takes place on the west side of Washington State, and Andrew and I are on the east side, about a solid, 6 or so hour drive. away. And so a lot of the structures, the density, the landscape, geography, very different approaches, but there was so much that we could take away by watching and observing and working with Sarah's team. So what we were able to do in our first real hands-on approach to being more of a community convener and helping our communities, not just being a place where they can come and receive services, but also being a place where our leaders in our community can come together to understand what pressing issues are facing our communities. So for the Spokane side, it was identified that firearm violence was a priority for our section and for many other places in the country. But in particular, our state decided to put some money towards really creating structures and decision-making groups to really begin to think about how can we make a difference in firearm violence in our state. And so this is a brand new project, very excited about it. We have recruited folks from our local governments. As we saw, was one of the most effective connections that we observed with Parkland, is having those political leaders in the room to really be a part of the process was invaluable. And so we have recruited city council members and local experts. Of course, we have our public health department and other social service agencies that will be represented in our decision-making group. We have folks from our education systems, nonprofits, and academic institutions as well. And our first meeting is actually tomorrow morning. So we're very excited, lots going on. But in capturing this broad spectrum of community, professions, academics, getting everyone together to kind of brainstorm. And some of the work our group has been doing from Excelsior is gathering the data and presenting, okay, here's what our numbers actually look like right now. Here are the populations and the communities that are disproportionately impacted in the Spokane area. And as we were putting this group together, we also recognized the value of having some non-traditional partners involved. And so not just being able to, convene your usual suspects, folks I think who often take part in these types of groups. We also reached out to the gun community in Spokane. And very surprisingly, we received a positive response in participation. So we will actually have some folks who own gun shops who will be participating in these and firing ranges, and who are very invested and are concerned and are going to be part of this process. One of the things that's always difficult about these multi-sector groups that get together is sustainability, and really making sure that everyone has an equal voice. And we're all excited at first, and then it can be hard to sustain that energy and commitment over the long term because everybody's very busy with lots of things to do. So we are making sure that we touch base regularly, and just like they did in Parkland, to have a community center where people can feel heard, where we could share research, get their feedback on it, and figure out how we can best move forward. So we have a two-step process in what we'll be doing. The first thing is a formal community needs assessment. So similar to what they did in Parkland, was really take into account. There's lots of data out there for sure, and we're aggregating that to help define some of these issues, but making sure that we're getting first person feedback from our community at large to see where they're experiencing this and how that impacts their lives. And that also can inform and will inform future membership in this decision-making group, and making sure we have all the right people together. we are, after the community needs assessment, we will facilitate the group through a strategic planning process. And hopefully at the end of that strategic planning process, we'll be able to continue to leverage and make enough governmental connections that we'll be able to really put into place and have the right leverage to begin to make actual changes that the group has identified that need to make, that need to happen. It's been really cool experience. We are at Excelsior, we are an integrated health provider. We do primary care, we do mental health outpatient services. And to be able to not just utilize our resources around those two particular products and services, to be able to act and expand our vision to serve the community at large and be this neutral convener for folks to come forward and be able to address some population-sized issues is really gratifying. And it's really an interesting and unusual direction for an organization like ours to take. And so it's very exciting. We have a 2-year project laid out that we're starting with, and we were so grateful for the wonderful timing of working with Sarah and her group and observing what they were able to do with Parkland and be able to really help and implement some of the lessons that they learned firsthand. Thank you.
Thank you all. Thank you so much to the research team for coming and presenting on some updates and things that are happening in your research project. And thank you so much, Anna and Drew, for coming and providing some much needed insight and commentary. We are now at the Q&A portion of our webinar. So if you have any questions, feel free to put them in the Q&A, and I think we should have time to address all of them. There are a few that came in that I'm going to ask again because we've typed out some answers, and I think it's a good opportunity for us to discuss them out loud. So the first one that came in was from Jackie Ward, specifically to Alya. And Alya, your response may be just the exact same thing that you typed out, which is totally fine. But the question is, why do you think youth would be underreporting information about their behaviors?
Yeah, thank you. So basically, I think that youth may be underreporting behaviors like substance use or vaping, since they're deemed as like socially unacceptable behaviors. So I guess there might be some social desirability bias in some response to that.
Thank you so much. The next question that came in was from Liz Nelson. And Sarah, I saw that you responded to this one. So if you want to elaborate on that. The question was, were any faith-based organizations involved to share resources or ideas for after-school activities?
Yeah, definitely. Yeah, I got a little enthusiastic with the Q&A. So that's a great question. As I responded, a lot of the community meetings were actually held in a local Lutheran church, which was a real community hub, because it's also right next to Pacific Lutheran University. So that's been a kind of organizing space, regardless of religious affiliation, but also members from that congregation were really active in the planning meetings. And then in the process of doing resource mapping and community outreach, a number of other faith-based organizations were contacted and invited to participate in planning meetings, as well as distributing the surveys through their congregations. So, and they're listed on the resource map as resources for the community to be collaborating with around their health plans. So it's a great question.
Thank you so much. And then I'm going to ask the other question that was answered via text as well. This one came in from Jason, specifically to Sarah. As part of the process, did community advocates emerge? We find that most communities have people that greatly care about their community and are often vocal about community needs. If so, how did you incorporate your opinions without letting their voice take over too much?
Well, I'm similarly enthusiastic as Jason in the question about citizens who are eager to improve their communities. Just so happy when anybody is wanting to come to some of like community planning meetings around these things. But yes, you know, there's that tension between what somebody personally wants and then sort of taking the expansive view around kind of the whole, you know, the whole view around community health needs and coming to some shared agreement. So I would say that in the period that we've been involved with around the information gathering and creating the report, one way that we would do that is make sure that we are putting information in front of the community kind of advisory board or participants to ask them to deliberate around. So having moments where we're asking folks to specifically kind of think about other community members' views in that way, and asking them to take that kind of zoomed out perspective, as well as advocating for what they directly want. But as I mentioned in my response, I don't want to oversell that too much in the context of this project, because the community is still deciding what they will do. So, you know, that's you know, whether or not that will continue. But also CoLab does a lot of kind of deliberative planning around policy and systems, and just I generally think it's a mix between strong facilitator skill and managing sort of a group in a room, as well as really thinking intentionally about the activities, sort of the workshop activities or methods that you're using to create dialogue, and to have folks have the opportunity to share their passionate opinions, but then also asking them to think about the broader view and then start integrating those perspectives.
Thank you so much. And I think that answer beautifully transitions into this next question, because you speak about the importance of facilitation and sort of building those relationships to keep the collaborations moving forward. But this question is about what recommendations you have for individuals or groups that are looking to establish this sort of work for the first time or in a new area, which I imagine is very daunting because there's a lot of trust building that needs to happen, and you're dealing with lots of different organizations that have competing priorities. So if you have any kind of first steps or recommendations to share, I think that would be helpful.
Yeah, absolutely. I do, because that's precisely what we were trying to do in this area. So I feel like we very much learned a lot. I would say really who you partner with as a convener is critical. It really needs to be an organization that's seen as credible for that health area or as a convener. And just off the top is kind of, even if it's a temporary convener until you find a longer term, an organization that wants to take on these sort of convening and strategic planning, collective impact activities in the long term. Even to start off, I think two really good options you could consider is your local community foundation or your public health department. I think both of those organizations tend to have good credibility, well, depending on where you are, but in general, tend to have pretty good credibility as neutral conveners around broad health topics, and are also not looking to themselves, you know, receive service contracts, or there would be less potential conflicts of interest as the effort is trying to sort of build momentum and funding. So I would say look to those maybe to start, but you might also have another really credible organization in your community that you consider. But that would be the lens I would look at it from, in terms of their perceived disinterestedness and competency as a convener.
Wonderful. I think that's very helpful. Moving on to the next question, what was the biggest challenge you experienced, if any, to the coalition building?
There were any. I think if I could, you know, one of the challenges, I think gets back to Jason's question, which is the sense of shared understanding of how the community wants to make decisions, and really developing some trust and consensus around just even how we use data, how we gather data, what data is used for, how we make decisions. I think spending the time I don't think personally, I'm just going to take this on for myself, I don't think we spent enough time in those conversations. And I think that, you know, where the community is at now is in a great spot. You know, they just got a bunch of money from the state. They've got a lot of passionate people who take this forward. I have a lot of hope for this initiative going forward, and we'll stay involved, as of course. But I think we could have kind of made the last year work a little more smoothly had I, as a PI on this project, just slowed some of those conversations down and made sure that with our partners, particularly like our lead community partner, like we had a similar idea about how we wanted to like use data and make decisions, and made sure that that was clear before we sort of launched into a lot of info gathering. But you know, Drew noted, these initiatives are just enormously complex. You can just run into challenges at every level. So like also, you might experience different challenges than that. And I really think it's just a process of like repair, rebuilding, and just knowing that's going to be a cycle, probably forever in this kind of work.
That's some real talk there. Alya, we have another follow-up question, which I think is in reference to the question that was asked earlier about the underreporting of activities from youth, but were they reporting anonymously?
Yeah, thank you for the question. Yes, for the Healthy Youth Survey, the survey is anonymous. Like a potential reason why they could be underreporting is because the survey was implemented in schools, so students may have some feelings about taking surveys that ask for their behaviors in school. So, and for the youth wellness survey that we implemented, that was also anonymous as well.
Wonderful, thank you. Yeah, and then personally, I used to work on the Healthy Kids Colorado survey, and we experienced the same thing. The children were doing the surveys at school, and there was a lot of underreporting of activities. So I imagine that's pretty common. I'm going to move on to our last question here, which I think is great timing because we'll be wrapping up in about 3 minutes. But we have a question from Katie Wilson, who says they're working on a nearly identical hub project now in Northern Virginia. They'd love to chat with you about your lessons learned. So maybe we can connect you after this webinar. The big question that she has now is, how did you go about creating a consolidated funding pool? And was that housed under the lead healthcare organization that you mentioned? How did you maintain resident-led structure in making financial decisions out of that shared funding pool?
The short answer is that the Parkland initiative is too early to like clearly answer those questions. What we're doing right now is connecting this community to other place-based organizations that have a longer kind of on-ramp for this and have been able to do more pooled funding over time and sustain pooled funding over time. In the 2 years we worked with this community, we were able to pool 3 sources of funding, but they've all been pretty like temporary. And the decision-making really happened in these community planning meetings where options were put in front of the group, and then there were priorities made, and then the lead community organization sort of moved forward and then reported back. So like a pretty like, typical structure. What I would say with these place-based initiatives, and I would love to connect with you all, because what we are trying to figure out in Washington State with our partners is whether we can be persuasive with local government, probably county, about pooling at the county level to then seed into infrastructure costs, partial infrastructure costs for these types of place-based coordination efforts. So that there's automatically some money that is coming in from pre-pooled funds that can be directed towards these services to try to sustain this as part of like just like any other sort of government infrastructure or planning. Well, we have a ways to go, but I think there's interest in that. My sense of the movement where it's at right now, and I see the time, Carrington, it's heavily philanthropically funded for health areas, which makes it very vulnerable. So we really have to figure out what is going to be the sustained infrastructure for this if we don't want it to disappear like it did in the 90s, like in another 15 years, So I think we have to figure it out sooner rather than later.
Thank you so much. And I think with that, we'll go ahead and wrap up. I want to thank you all for coming and presenting today, and thank you everyone else for attending. I think we have two really, really fast announcements. If you want a certificate of completion, we do offer these. If you just indicate in the survey after we end the webinar that you want one, we will send it to you in a timely manner. And then next slide. And then, like I mentioned at the beginning, this is an ongoing webinar series. Our next Research in Progress webinar will be held on Wednesday, June 12th by a team at the University of California, San Francisco on their project, looking and doing a deep dive on CalAIM and trying to identify some key facilitators of cross-sectoral coordination for individuals with complex needs or at high risk. So if anyone wants to attend that, we will send a link to register for that webinar, as well as a PDF of these slides and the recording from today's session after today. Thank you again for joining, and I hope everyone has a wonderful rest of their Wednesday.